I next want to turn to Jennifer Newberry. Jennifer is an assistant professor in emergency medicine, and we did hear her briefly give a poster before, but now she's going to talk about women in crisis, an analysis of calls to a women's helpline in Gujarat, India.
Okay, thanks, Steve. So good afternoon. As Steve said, I'm Jennifer Newberry, and I'm from the Department of Emergency Medicine. And I'm sharing our work on behalf of our team of collaborators, both from emergency medicine as well as from the Biomedical Informatics and Research Group, and the work that we've been doing to look at women in crisis through analysis of calls to a women's helpline in Gujarat, India. So per usual, I have no interesting disclosures yet, so we'll go right on to background. In India, 37% of women will experience some form of intimate partner violence in their life, whether that's physical or sexual. And if you ask women in the last 12 months, almost a quarter of them will have experienced intimate partner violence. What's tragic about this is just the tip of the iceberg. This doesn't include other kinds of violence like verbal abuse, stalking, eaves teasing. It doesn't include other perpetrators, family, friends, strangers. So even with these staggering statistics, it's just a little bit of what women are experiencing every day. What saddens me more is that less than 1% of women will ever seek help beyond family or friends. So what can we do to change this? When we think about change, what is the framework for how women seek help? Well, I like looking at this one. There's 4 key elements. One are the norms in which women decide to choose help, whether that's their individual beliefs, social, cultural beliefs, or the ones that they get from their families. But then there's 3 other key elements, whether they recognize violence as a problem, whether they decide to get help, and what is the support that they choose. And I like this framework because it allows us to hypothesize, if we build a better support network, can we increase their decision to seek help? Can we increase their recognition of violence for what it is? And that's exactly what underlies 181. So 181 is a women's helpline in Gujarat, India, and it's there 24 hours a day, 7 days a week, free of charge. Women can call and they can get counseling on the phone, they can get connection to services, they actually can get rescue on the scene by a social worker and a police counselor. And so what we wanted to know is, while we've watched demand grow for 181 over the last couple of years, our question was, what are women calling for? What experiences are they willing to share with someone they've never met, that they may never see? What will they talk about? What do they need help for? And so what we did was we included all calls from the launch from February 2014 through the end of 2016, and we excluded any call that didn't have a caller narrative. And what the caller narrative is that counselors will type down a brief synopsis of what the woman is calling about. So anything that didn't have that, we didn't include. And then we utilized 2 different approaches. So our 2 different approaches is, one, we took a traditional narrative review, so just your basic qualitative analysis approach. And then we actually had another team, and this was Nigam Shah's team, that used computational analysis to look at the data. And then throughout the year, we've been comparing our approaches and seeking to refine them. And so for the traditional narrative review more specifically, is we took a simple random sample of 1,000 records, and we sought to reflect the gender makeup of the calls, which was 89% women, 10% men, and 1% that didn't specify. And then we asked 4 key questions. Was there gender-based violence present? What was the nature of the violence? Who was involved? And then we used grounded theory to identify other themes. As far as the nature, what we used was this framework from the WHO. Was there physical violence, sexual violence, psychological violence, or this other category of deprivation that I'll get to a little bit more later? And then we broke down the category of perpetrators by self-directed violence, family, and community. And then we didn't really see collective violence in this set. Now, the computational analysis, and I will ask for your patience for this because this is not my half of the team, worked this way. Was they first initially created a word cloud, and then they iteratively cleaned it, going from a raw to a clean set. And you see even here that you see harassment kind of begins to stick out a little bit more, and husband as a perpetrator, and that's reflected in our data. So the first step was a lot of cleaning. But then from there, they used different clustering approaches to start kind of finding different patterns. And so that started with single word frequencies followed by bigram analysis and then to network clustering. And I'll show you some more pictures of what I mean with that. So what did we see? Well, I'm going to start with our traditional narrative review. What we started with was 200,000 calls during this period that narrowed down, once we excluded those without a caller narrative, to 80,000. We took that 1,000 random sample, and then we found from those about 861 of those were actually analyzable. So about 0.1%. It's a very small amount from what we originally started with. What was great was that we saw that we had distribution across the entire state. This is the daytime, so this is 8A to 8P. And what you see is if you know Gujarat, this is basically the exact same shape of Gujarat. And those small little areas where you actually see black right in the middle, those are actually animal preservation, so people don't live there. And there were calls from every district, every taluka. It was really impressive. And then when you go to nighttime, while the density decreases, the distribution doesn't. So women are using it across the state. It doesn't matter if it's urban, doesn't matter if it's rural. Now, when we looked at the perpetrators, so there were 750 out of that total, so about 87% where there was violence indicated in the call. It was mostly family at 72%, but there was a significant amount that was committed by a community member, whether known or unknown, and that was about 26%. And then sadly, there were a number of cases of either self-abuse, suicidal ideation, suicidal attempts, and that came in at about 2%. When we look more at that group in the family, not surprisingly, as you saw from the word cloud, husbands were the most common perpetrator at 38%. But another big one was 23%. And this has a lot of implications, right? We hear about a lot of interventions aimed at young men, at women, but how often do we hear about interventions that are talking to families? And yet this is how common they are as perpetrators in gender-based violence for these women. Now, when we looked at the nature of violence, largely, and again, that statistic at the beginning was physical and sexual violence, it was actually largely psychological violence. And then we were surprised to see, and I have to say this is actually smaller than I thought it would be, 8% were deprivation. And I think that's for me, as I was reading these records, it just really stood out as an incredibly common and just connected with me as a form of violence. Break it down psychological even further, most of that was harassment, which I would describe as verbal abuse, verbal intimidation, not so much threats as to bodily harm as you would see with assault, but mostly harassment and some stalking, both by telephone and physical, and actually, in addition, by cyber. Deprivation was different. So deprivation, our most common one was forced removal from the household. And what this was is that women were being kicked out of their homes, mostly by in-laws, as a way of kind of controlling them, as a punishment. And we also saw it by parents as well. And these women were calling because they didn't know where to go. They didn't know what to do. But we also saw a lot of restrictions on freedom of movement. And they may have meant confining women, but also may have taken their children as well. So in the themes, we're continuing to refine them, but these are some of the key ones. And what's interesting to note is while alcohol comes up, it's alcohol across a couple of different ways, whether that's abuse and related to violence, whether that's harassment due to black market, because Gujarat's actually a dry state, or it's because women want to seek help for their loved ones who are alcohol dependent. Other common ones were love marriage, marital issues, and then police was a huge one. Women were calling because they had gone to the police, they had actually tried, and they weren't getting a response. Now, on the computational analysis side, as I mentioned, we started with single word frequencies after cleaning. This is our top 10, and it's congruent with what we're seeing in the traditional narrative analysis. Husband, harass, beat, mentally torture. The odd one is party, right? There are no parties in these call records. Party is part of this coding system that they use for calls that are made on behalf of women. It's a third party calling in. So it's important to have that traditional review to give meaning to what they're saying when it comes to party. Now, when we take that and we start looking for clustering, as I mentioned, we're looking for connections between words. We use a community detection algorithm. And what it is you just see kind of the connections in these different groupings that come out. And to blow that out a little bit more, what we see in orange is what we were hearing about earlier with the nature of violence. Husband, mentally torture, harass, in-laws, alcohol. But what was interesting is that in our traditional narrative review, we actually didn't see much of that green category of workplace violence or workplace complaints. And so it's something we completely missed by just doing that random sample. Important to know is that this community detection algorithm, what it does is it notes frequencies and it notes connections, but it doesn't note weights. So we don't know how often this is happening or kind of what to draw from that meaning. What we're trying to do next is some deep learning with glove embedding, a procedure that was developed here at Stanford to see how, when you take away harassment from husband, well, then who are the other perpetrators? Or when you take harassment away from husbands, what are the other things that are connected to that? So challenges were that the language structure was very different. Meanings were different, structures were different. So for example, in computational analysis, you'll tend to use a word or 3 n-gram structure. But here, words might be spaced out a lot by 5 or 6. So our next steps for refinement are to use different approaches. Computational analysis directing traditional narrative review, so looking at that workplace violence. Traditional narrative directing computational analysis, so take deprivation, create a learning algorithm, go find more in that 80,000, and then iterative discovery. At the end, this was a crash course in team science. It was, how do we talk to teams across different methodologies without actually biasing their results? We found that the traditional approach provided depth, whereas the computational analysis provided power as well as new insights, but both were necessary. So finally, the conclusions that we had were, first, women are seeking help for a wide variety of experiences. Just going back to that framework in the beginning, they built a new support selection or new support structure. It was good, it was responsive, and women called for a wide variety of experiences. These approaches can be used synergistically, and it's necessary to do so, and it's advantageous. And then finally, call center records are an incredibly important source of data that have been underexplored. Thank you.
Questions for Jennifer?
Jennifer, that was terrific. Can you share what you're going to do with the data? We've been talking about how we can take data and make it into policy. I know you have some thoughts about that.
Yeah,
Can you
absolutely.
share that?
I would say 3 different ways come to mind. One is, what's great about doing this work in the way that we've done it is we've been partnering with the operational partner as well as the government. So it gives us an opportunity to be a voice for women, to provide back feedback to the partnership to say how frequent the police issues are, how much more training needs to go into things like how counselors handle deprivation. So some of it's on the operations end. For me, actually, my personal interest is in deprivation, and how do we take this as a clear and frequent cause of gender-based violence, but under the law, it's not recognized as violence. And so how do we go back and actually influence through kind of the normative power of law? And then finally, other things like the educational insight of how do we reach out to in-laws and families and how they raise young women? So advocating for other kind of NGOs is these are new ways that we can influence and move the kind of move the metric. So those 3. Hey, Sherry.
Jennifer, really fascinating work. Were you able to tell the gender of the in-law? So is this primarily mothers-in-law or?
It's still, when we broke down the in-laws, it was actually still predominantly men, whether that was fathers, brother-in-laws, son-in-laws. Mother-in-laws, as far as the female in-laws, were the most common, but actually still men.
Thanks.
Jennifer, I think this is really important work, and I really credit you for taking an approach that's this innovative. What some others in the audience may not appreciate is that your primary training is an emergency medicine doc. Mm-hmm. And we have a lot of young students and people who are wondering about how can they go from whatever background they have to doing something that's impactful on a global health scale. Looks like you've taught yourself a lot in order to be able to do this really important work. And I just wonder if you might offer a few suggestions to people earlier in career who might have similar aspirations.
Let's see. I think just don't be afraid to be creative. You know, seek out mentorship that's going to support you in what you're passionate about, and recognize that, well, I love medicine, I love being an emergency medicine physician. The way that we connect with people and the way that we advocate for change requires so many different players in the field, and the more that you can work with others and explore these different pathways, the more you're going to be able to have impact.
Thank you very much.